stem cells which have regenerative powers. And the procedure that has no down. Guys, I am Dr. Haroon Rashid. I am a dermatologist. Today we are going to discuss a very new regenerative technology of exosomes in dermatology. First of all, I want to put a bit light on the exosomes, what it is basically. These are small vesicles which are released by the cells which contain proteins, lipids, cytokines and some genetic material, and they do have some regenerative repairing effects, and the communication between the cells and the cell metabolism, cells function, they are improved or they are altered in a positive way by exosomes. So these techniques are being used in cardiovascular systems, in different diseases, in osteoarthritis, in Alzheimer's disease, in Parkinson's disease. But here, today we are going to discuss the role of exosomes used for hair restoration. These exosomes, they are derived from mesenchymal stem cells which have regenerative powers. They can have a positive effect on the hair follicles and the scalp and the overall environment of the scalp. They can reduce the inflammation. They can prolong the anaphase, particularly of the growing part of the cycle of this hair. So when the hair cycle that is mainly positively affected, that anaphase is prolonged, so hair they stays for a more stronger, more dense, and for a longer period on your scalp. They become thick, they become dense, they become long. So basically, these exosomes, when injected in the scalp, they play this role with the hair follicle and as well as your scalp condition. They improve scalp as well as your hair density and their hair thickness and hair length. Now these exosomes solutions, they are available and we can inject in multiple sessions, one session per month for like 4 to 6 sessions into the hair root. This is a precise basically way to submit the exosome solution to the hair follicle where it is basically targeted neatly over there. And the procedure that has no downtime, you can go, you can have your golf, you can have your football after a couple of days. So this is a benefit of the procedure. And secondly, if you compare it with this hair transplant surgery, it's less invasive procedure, and they remain fairly good enough. This procedure can be complementary procedure with PRP, platelet-rich plasma technique, or they may prove an alternative to the PRP in the future. Still, many researches they are going on to confirm the pros and cons and the long-term side effects or long-term effect of this technique. So this is a bit new, but still a very promising field will be well introduced in the future for the various fields, including aesthetic medicine. Like the YouTube channel of mine and hit the bell to get the notice of future videos like this. Thank you very much for watching.